to be performing a setup of a sterile field. I've combined a couple different kits so that I can show the different skills. So the first thing you want to do is you want to gather your supplies. So I'm going to grab this wound care tray, and I'm going to make sure it is intact. I'm going to make sure it's not expired, which it's not, that there's no moisture or anything leaking from the tray. And my kit has been used a couple times for practice, so it's not entirely intact, but it should be. Alright, so now that I've got my supplies, I'm going to go ahead and do my hand hygiene. And rub that in well, and then I'm going to clean my workspace. I'm going to grab a wipe, and your workspace needs to be at waist level or above. I'll write that down. And you would also want to let this dry for about 5 minutes, but for the purposes of the video, I'm just going to go ahead and move on. So now I'm going to bring my supplies to my workspace. Okay, I'm going to go ahead and open up my tray. All right, once I got it open, I'm going to grab my drape, and I want to touch the blue side of the drape. I'm just going to kind of shake it out, and the blue side is going to go down on the counter, and I'm only going to touch the back side of that drape as I lay it down and get it positioned. And as I'm working, just want to keep in mind that the outer 1-inch border of the drape is not going to be considered sterile. All right, next I'm going to put some packaged supplies onto the drape. So I'm going to grab the package, and I'm going to open it about 6 inches away from my drape and dump the supplies on the drape, and then I'm going to dispose of that. All right, next I'm going to go ahead and get my gloves out so they're in place for when I'm ready for those. And now I'm going to pour some sterile solution into my tray here. So I'm going to uncap it. And once I uncap it, I want to place it cap side down away from my sterile drape. I'm going to pour about 2 inches above my gauze to make sure there's no splashing. And then I'm going to recap that and put it away from my sterile area. All right, last thing I'm going to do is I'm going to put on my sterile gloves. So I'm going to open this up, and I only want to touch that outer wrapping, never the inner wrapping. Open this up here. I'm going to start with my dominant hand. And only again touching the inside of the glove. All right, once I've got that one on, I'm going to reach inside the second glove. Place my hand in there. And then once I have the gloves on, I can do any repositioning I need to. All right, now I've got everything ready to go and do my procedure. As I move forward, I want to make sure my hands are above waist level at all times to maintain the integrity of the sterile field. And then I'm never going to turn my back on the sterile field either or reach over it as I go.